Dear audience, I am so glad to be here to present our team's research findings. The subject of our study is a case report and literature review on genetic testing technology assisting in the diagnosis and treatment of multiple suppurative arthritis and extensive migratory skin and soft tissue infections caused by disseminated Staphylococcus aureus disease. Now, let's delve into the background behind our research. The multiple septic arthritis and extensive migratory skin and soft tissue infections caused by Staphylococcus aureus, S. aureus, are uncommon. The infection can be life-threatening. Early, targeted antibiotic therapy is critical to improve prognosis. However, routine cultures are time-consuming and have low positivity rates. Genetic testing technologies, such as macrogenomic next-generation sequencing, (MNGS), and digital polymerase chain reaction (dPCR), are now emerging as powerful tools for early pathogen diagnosis as well as pathogen diagnosis of target detectors with low microbial loads. In this study, we report a 53-year-old man who was admitted to the ICU for treatment of septic shock. The causative agent was targeted earlier as S. aureus by MNGS, and the shock was corrected more quickly with targeted antibiotic medication. However, he later developed multiple septic arthritis and an extensive migratory skin soft tissue infection with persistent fever, and at one point a gram-negative bacterial infection was suspected, and the antibiotic regimen was incorrectly changed. Blood dPCR suggested that the causative organism was still methicillin-sensitive S. aureus, MSSA, with no drug resistance gene detected, and the anti-infective regimen was readjusted, and the patient eventually recovered. Through this case, we obtained the following results. The MNGS technique has the potential to facilitate the earlier identification of pathogenic bacteria than is possible with conventional culture techniques. This enables the implementation of early antibiotic-targeted therapy. Furthermore, in instances where the pathogen load is low following antibiotic treatment, the utilization of dPCR technology enhances the positive detection rate of the causative organisms. The aforementioned genetic testing techniques, which played an instrumental role in the treatment of our patient with DSD, contributed to the patient's recovery. We present this rare case and review related studies to validate the superiority of genetic testing technology in pathogen diagnosis, which deserves further application. We expect the findings of our study may also inform the management of other patients with severe infections of unknown etiology. Thank you for your attention.